WNYT, Albany, in HD. News Channel 13, live at 5, begins right now.
Good evening and thanks for joining us. I'm Benita Zahn.
And I'm Jim Kimbrick. Our top story, the U.S. Supreme Court upholds President Obama's overall health care reform, including the controversial individual mandate.
It also allows a federal penalty for Americans who don't buy health insurance. Our team coverage begins with Steve Handelsman. He's live in Washington on this day.
Thanks. Good evening. Here at the U.S. Supreme Court, this decision in this huge case came as a shock to many court watchers and many Washington insiders. And you can sum up their surprise in 7 words. Chief Justice Roberts sided with President Obama. It was chaos at the court as the decision of the year was rushed to TV cameras and to the nation. The Affordable Health Care Act upheld 5-4. Chief Justice John Roberts breaking with fellow conservatives, joining liberal justices to declare the so-called individual mandate constitutional. He ruled the penalty in the law for not buying insurance amounts to a tax. Because the Constitution permits such a tax, it is not our role to forbid it, Roberts wrote.
What is with this court today?
Conservatives were enraged.
This is clearly a turning point today in American history.
And it's a huge political win for President Obama. But he ticked off the benefits to citizens. Guaranteed coverage, even with pre-existing conditions. No more dollar caps on coverage. And he praised the justices.
They've reaffirmed a fundamental principle that here in America, in the wealthiest nation on earth, no illness or accident should lead to any family's financial ruin.
Democrats in Congress are ecstatic.
We now know that health care is legal, constitutional, undeniable, and irreversible.
Irreversible? Mitt Romney vowed he would see it repealed.
This is a time of choice for the American people. Our mission is clear. If we want to get rid of Obamacare, we're going to have to replace President Obama.
Republicans in Congress won't wait.
I've scheduled a vote for total repeal of the Obamacare bill to occur on Wednesday, July 11th.
President Obama says today's ruling ought to mean moving forward to implement his health care law. But Republicans say the ruling here merely marks a fresh start in their fight for repeal. Live at the U.S. Supreme Court, I'm Steve Handelsman reporting. Now back to you.
This decision directly affects millions of uninsured here in the Northeast. That includes roughly 2,886,000 uninsured residents of New York State. In Vermont, 59,000 are uninsured, and in Massachusetts, about 120,000.
Medicaid eligibility is being expanded by the Affordable Care Act, but that won't affect New York, which already encompasses people at the higher end of the poverty level. As for changes that will be implemented, I heard mostly favorable reaction from those on the front line of health care.
Pleasantly surprised.
But now the work begins, says Dr. John Bennett, President and CEO of Capital District Physicians Health Plan, getting the uninsured covered, expand preventive care, and boost the ranks of primary care doctors who will be needed to care for all these people. But the ranks of the primary care doctors are thin.
As you know, our enhanced primary care program, which is our version of the patient-centered medical home, we are enhancing their ability to deliver care to their patients who are our members. We're enhancing their payment significantly.
Dr. James Reed, president of St. Peter's Healthcare, agrees. Relieved the CARE Act remained intact. He says with more people insured, the health of our population and that of a hospital's bottom line improves.
But this is a chance to have people covered, to have them getting primary care and preventive care before they have to show up at the emergency room in an acute state, which is not obviously good for them. It's also a much more expensive way to take care of people.
Under the Affordable Care Act, we'll see health insurance exchanges set up, a sort of clearinghouse from which you'll buy health insurance. Blue Shield is already gearing up for that.
Help people access the pool, but also help them improve their health and help them help them participate in managing their own health as well.
Managing and being responsible for one's health is key to holding down costs, says Mark Egan, president of the Albany Colony Regional Chamber of Commerce. While he holds an optimistic view for his members, he knows many small businesses worry the weight of the cost to implement the Affordable Care Act will be too great.
We really have to have a national debate on how do we control costs.
This is YNN, your evening news now.
By and large, Thursday's Supreme Court ruling won't change much to Massachusetts' state-run universal health care system. As our Brandon Walker tells us, Governor Deval Patrick and local health care advisors agree the decision likely will help the state's push to drive down costs.
How to pay for it remains a central question in opposition to the federal government's health care law, and one with which leaders in the Bay State continue to grapple.
The victory for the American people.
Massachusetts Governor Deval Patrick praising the High Court's decision Thursday as one likely to save lives.
High health care costs and inadequate access to care are significant national, economic, and social challenges in this country. Congress acted in 2009 for the same reasons our legislature and Governor Romney acted in 2006.
The reason? Patrick says it's because health is a public good, though what may be good for the public comes at a cost for federal and state coffers.
Change is expensive.
The root of that change, says Brian Ayers, CEO of Community Health Programs in Berkshire County, is redistributing coverage costs in order to make sure everyone has insurance. In Massachusetts, that starts at the State House.
They're doing that by kind of stepping in the middle of the water balloon. Those costs are then going out to the communities to deal with.
Which, if you're Massachusetts, that means you're spending a lot of money to keep insurers happy while providing universal health care. Community Health Programs provides medical care to 14,000 patients. That's 12% of the population here in Berkshire County. Of that percentage, 40% are on Medicaid. Another 10% are not insured. Costly? Yes, though Governor Patrick says it hasn't broken the bank.
And premiums have stabilized or are going down, not growing.
A downward trend both the governor and Brian Ayers suspect will continue through the health care law's Medicaid provision.
We are an early expansion state, as you know, and we're expecting further resources from the federal government to sustain the experiment here in Massachusetts. So good news for us.
Ayers suspects that money will not come in overnight. Still, resources, he says, will help along the way for a clinic that adds anywhere from 150 to 200 new patients each month. In Great Barrington, Brandon Walker, YNN.
From WNYT, Albany, in HD. News Channel 13, live at 11, begins right now.
They've reaffirmed a fundamental principle that here in America, no illness or accident should lead to any family's financial ruin.
Tonight's top story, legal and constitutional. The Supreme Court rules in favor of the president's controversial health care reform law.
Starting in 2014, Americans will be required to buy health insurance or face a penalty. Good evening and thanks for joining us. I'm Jim Cambridge.
And I'm Jessica Layton. Good evening. The decision was a close one. Justices upheld the Affordable Health Care Act today by a 5-4 vote.
It's a huge election year win for the president. But as Steve Handelsman reports tonight, the health care fight is far from over.
Attention! Listen up! Attention! The crowd outside the court was surprised.
Oh, yes!
The Obama health care law was upheld. Conservatives were outraged.
America will never be the same.
Conservative Chief Justice John Roberts sided with court liberals to say the penalty in the Obama law for not buying health insurance is a tax. Because the Constitution permits such a tax, Roberts wrote for the 5-justice majority, it is not our role to forbid it. The court did limit the federal government's power to force states to take more Medicaid patients. But the Affordable Care Act goes forward, guaranteed coverage, and every American included, like it or not.
I was hoping for the whole thing to come down.
We have to unite and fight this.
I'm very happy with the decision that was made today.
We've worked for this for a long time.
President Obama praised the High Court's decision.
With today's announcement, it's time for us to move forward, to implement and, where necessary, improve on this law.
But House Republicans scheduled a repeal vote for July 11th, and Mitt Romney said he would sign a repeal if he wins.
If we want to get rid of Obamacare, we're going to have to replace President Obama.
But it's Barack Obama who got a boost today. I'm Steve Handelsman, NBC News, Washington.
This decision directly affects millions of uninsured here in the Northeast. That includes roughly 2,886,000 uninsured people in New York State alone. In Vermont, 59,000 are without insurance, and in Massachusetts, there are about 120,000.
There are few issues that affect virtually every single American, but health care is one of them. And if you take the pulse of the American people on this one, you get mixed reaction. Everything from disgust and anger to relief and celebration. The law remains controversial and complicated as families that are uninsured right now try to figure out what this means moving forward. 9-year-old Charisma Franklin isn't a fan of going to the doctor.
Scared.
But without a full-time job, her father feels just as uneasy about not being able to afford health insurance at all.
It's too expensive. Everything's expensive.
Elton Franklin holds his breath every time his kids get sick, but he's breathing a sigh of relief now that he's being promised health insurance is about to get cheaper. After months of anticipation, the Supreme Court upheld most of President Obama's controversial health care law, the Affordable Care Act, making health insurance mandatory for nearly every American.
Unless you make it mandatory, it will not happen. People can always find another reason to spend their money rather than on a health care premium.
The president of St. Peter's Health Partners agrees. Dr. Jim Reed says with more people insured, the health of the general population improves.
This is a chance to have people covered, to have them getting primary care and preventive care before they have to show up at the emergency room in an acute state, which is not obviously good for them. It's also a much more expensive way to take care of people.
But groups rallying at the Capitol aren't convinced they'll be able to afford the so-called affordable insurance. They still want Medicare for all.
What has happened today is not a victory. We need to go farther.
It's perfect. Elton Franklin knows he may not find a perfect fit in a health care plan, but he believes whatever he ends up with will be better than nothing.
We can go and pay a little bit of a copay and be treated and know everything's going to be all right now.
No surprise, the healthcare ruling was the big story getting the most attention on our Facebook page today. Tammy supports the decision, calling it a victory for adults and children with chronic illnesses. Quote, adults and children who could not get insurance for their pre-existing conditions. Linda disagrees, saying it's more government rules and running your life for you. So much for freedom. Meanwhile, Sean is asking, so when will the government require lifestyle changes in order to save costs on healthcare expenses?